Hi, I'm Dan Depew, the Chief Communications Officer with Middletown Medical, and good morning. We are here talking with a good friend and one of our medical providers, Podiatrist, Dr. Michael Wodka. Good morning.
Good morning, Dan. Thank you for having me.
As we always do, we just want to let everybody know that social distancing is important. That's why Doc and I are more than 6 feet away, and it is policy at Middletown Medical that we always wear a mask when we're inside of our buildings, and we encourage our patients to do so as a requirement here as well to keep everyone safe during these times. I want to talk a little bit about your history here in the Middletown and the Hudson Valley area. I mean, Doc, how long have you been practicing?
I've been in Orange County for 38 years now, and thanks to my friend Dan Depew and a happenstance meeting last year, I am now on Middletown Medical staff. I sold my private practice. I'm here and I'm enjoying practicing without the hassles and the rigors of private practice. I'm able to do everything that I did, and I'm seeing all my old-time friends and patients.
Well, I'm one of your patients. I can tell you, I remember coming to your building and meeting with you when I've had foot pain issues, different things throughout the years. And you've always been very helpful to me. So I think it's a boon for all Middletown Medical patients to add you to our great list of podiatrists that we already have. And great for your patients to know that you can still see them and take care of them as part of our Middletown Medical practice.
It's nice to be able to see all my old friends. I've got patients that are coming to me. I've seen them 30 years or so. Some are snowbirds. They come in. I still give them a little bit of a hard time. Why didn't you take care of these toenails sooner? But, come on back and we'll take care of it. Feet are not supposed to hurt, Dan. You know that. We've had that discussion many, many times.
That's right.
How many people walk around, you see them limping, you see them hurting, or you hear their stories. Everybody's got a foot story.
That's right. Yeah. I know that whenever my feet have hurt and I've come to you, you're like, Dan, why did you wait? Why didn't you get in here sooner?
Why didn't you get those new shoes yet?
That's right.
We're not going to pan down to your shoes. We're not going to do that. But seriously, the right foot gear, it's not going to solve every problem. But versus the wrong foot gear for any particular condition or problem like you're having, foot gear is not going to cause the problem, but certainly it's going to be of benefit if you put the right things on your feet. We're standing, we're walking all day.
Absolutely.
We are the only mammal that's erect, walking on our hind legs. Heel pain, plantar fasciitis. You hear about star athletes being out for something as common as plantar fasciitis, a heel spur syndrome. Incredibly painful. And people walk around putting up with that when they don't have to. A simple x-ray, a simple diagnostic procedure, pushing on that spot, telling someone, a little injection in there might hurt like you know what, but you're going to walk out of here feeling fine.
Right. Have you seen people putting off procedures or putting off podiatrist visits because they're concerned about COVID-19?
For sure.
And the procedures that we have put in place and the policies and the safety protocols have allowed us, we've reduced waiting room seating. People can call in from inside their car. We are very, very mindful of cleaning after every patient and taking care of that. So there should be no reason why anyone is coming in worried to our office for something, whatever procedure they need to get done, particularly concerning their feet. And what we're telling people is now's the time to come back. No longer put it off. We're coming up on the winter, and we certainly don't want people who have had foot pain throughout the summer to carry that through the winter, shoveling snow, different shoes, walking conditions. This could really hurt them and potentially prevent them from having the type of life they want to live and the type of mobility that they should have.
A simple problem like an ingrown toenail, another topic. Oh my goodness. Talk to someone who's had that before. Oh my Lord, painful. Going to a doctor, maybe a doctor who knows what they're doing, maybe doesn't understand how much that hurts. But a podiatrist, and you mentioned we've already got 2 fine podiatrists on staff. I'm the 3rd coming on board. Yeah. But simply evaluating that, an injection if we need to, a permanent procedure to take that chronic problem and knock it out completely, to never ever suffer from that again. And you're right, why put that off? Because if you have a simple problem that's on the borderline of being infected, once that gets worse infected, you need more oral antibiotics. If that person's a diabetic, we don't want to think about those kinds of problems in the at-risk population.
I personally can attest to that too. I've had problems with my toenails. It's just a genetic thing. And the first time it gave me a problem, he said, Dan, we've really got to take care of this. And I said, no, it'll be okay. We'll just trim it. We'll just do this. He said, but it's going to come back. And you were 100% right. And it was taking the procedure to remove part of that toenail properly and doing it without it being infected, which that's been done for years now, and I haven't had an issue. So I thank you for that. But how many other people out there put something off like that because they're like me and they think, I can fix this myself at home, or I can do this myself? You're never going to be able to do what a trained podiatrist can do. And it is the time to address it is now.
Okay.
Doc, every time I come in to see you, you're always wanting to look at my shoes. And you're constantly studying not just the treads on my shoes and the width of my shoes, but you're looking also at the back of the heel of the shoe. Why are the shoes so important? Why are they such a roadmap to what you see is going on with someone's foot?
I love that question. That shows us, as I said before, about, spinal alignment, knees and backs and hips. But when we take off anybody's shoes, take that and look at the bottom of it. Everyone is going to have wear on the outside of the shoe. But when I pick it up, if I see an asymmetrical wear, more wear on the inside of a shoe or more wear under the big toe joint on somebody with a bunion, the shoe can be very diagnostic, almost as diagnostic as an x-ray, believe it or not. An x-ray is going to show me the picture of those bones. That's the anatomy of what's happening. But once I look at a shoe, it's almost a forensic kind of thing. You're looking at that and seeing the pattern of wear. It's mostly looking for the asymmetrical pattern of wear and seeing if that goes along with whatever my differential diagnosis might be.
Doc, I'm not a diabetic, but I do have folks in my family who are. How often should they be coming in once they're diagnosed just to have regular checkups on their feet and to make sure that anything that they can get ahead of, because we know diabetes can be a progressive disease that doesn't progress in the right way. So talk a little bit about that.
I think anytime a person has been diagnosed as a diabetic, they really ought to have their primary care doctor say, in addition to, you understanding about your blood sugar and understanding about your nutrition, you must understand about the things that can go bump in the night. And one of those is a foot problem. As we're walking around, the diabetic may have some circulatory compromise. They may have some neurologic compromise. They may not have the same sensation and not know that infected ingrown toenail, which you or I would feel because we're not diabetic.
Keep us up all night. They wouldn't even know about it.
If they're neuropathic, they'll come in, and a lot of times they may say, the undiagnosed diabetic will say, I saw blood in my sock, but it doesn't hurt.
Oof.
When I hear someone say, I saw blood in my sock, but it doesn't hurt, we can almost assuredly say that's an undiagnosed diabetic. Or just testing someone's sensation and finding out they've got numbness or they've got diabetic peripheral neuropathy. Explain to them that you have to compensate. You have to visually inspect your foot because you may not be able to feel that something's going wrong. At first, that neuropathy is going to give them tingling and strange sensations. But ultimately, diabetic neuropathy could result in someone having a rock in their shoe, a pebble in their shoe, a nail in their shoe.
Wearing into their body and they don't even know
it's there. Not even knowing it's there. And oftentimes they're elderly, maybe arthritic, they can't see their foot, maybe living alone. The diabetic needs to see a podiatrist at least yearly, preferably twice yearly.
You've talked too about, there may be shoes that look good, but they're not good for you. Especially pointy shoes that make crowding of your joints and crowding of your feet. So, what's more important, the shoe that looks good or the shoe that feels good?
It's function over fashion. We all want to, yourself included, want to put on something that looks nice. We all want to put on something that's decent, but we all want to, more importantly, put on something that's going to be comfortable for us. A shoe that's too small, for example. I had someone ask me the other day, whenever I'm out running or walking, my second toenail always turns black. Well, I said very simply, that's because that second toe is too long, and as you're walking, it's hitting the front of the shoe. With the front of the shoe being hit by the nail all the time, you're going to get a little blood blister under there, you're going to lose that nail, and then eventually, if that's a chronic kind of problem, it's going to become a fungus nail, because once that nail is lost a couple times, there's nothing there to protect it from getting a fungus. So it's very important that the footgear be your friend and functional, assuming you've got a foot problem. How many people walk around without a foot problem?
Right.
But those aren't the ones that I see. And I will. You know my attitude, Dan. I could be a little harsh.
No, you're
bit
you know what,
directed.
Doc, you're direct, and
Yeah.
it needs to happen because sometimes injections in the foot are painful or a little scary. Nobody wants to have a needle put in their foot, but I have to tell you, the pain goes away very quick and it's very effective. And also the work that you do with toenails, or even when you say, I'm going to push pretty hard here, this is going to hurt for a little bit. But what you're doing is you're drawing out the pain that's been in the person for a while, so that way you can have a real discussion about how to fix it. And that's why you're very effective as a great podiatrist.
Sometimes the solution can be somewhat painful. No one likes to think about an injection in their heel.
Right.
Heel spur injections can be very uncomfortable. But after that injection, after someone says it still hurts, and I'm rubbing and rubbing and rubbing and pushing very hard, I say, Dan, does this hurt? And Dan says, no.
No, it's gone.
It's gone. It's the combination of what we're putting in, a little bit of Novocaine, a short-acting Novocaine, a longer-acting Novocaine, and a scooch of steroid in the right spot, with the right hands for the right diagnosis, makes all the difference in the world.
Tell me about orthotics. What's the importance of orthotics? Everyone says, oh, you have to have orthotics, or you could just buy something off the shelf. And your experience, over 35 years of work in this field, and all of your background, tell me from your perspective why it's important to have good orthotics.
As mentioned here earlier, there's a very, very, very good late-night infomercial. This podiatrist sells these things called Miracle Foot or whatever. It's a prefabricated orthotic. But he talks about spinal alignment. He talks about knees and backs and hips. They go into malls. They talk to people who are hurting. As I see you adjusting your feet right now. But talking to people who are hurting, for whatever reason, if you have a chronic back or a sciatica problem, if you're functioning with one leg a little bit shorter than the other, if you've got a heel spur, simply putting something in your shoes to hold that foot up, to hold that foot where it belongs, to realign that. It's not just the foot. It's the knee. It's the hip. It's the back. It's the posture. I'm not saying we can correct everything on every patient, but a simplistic little thing, putting something in a shoe. I had a patient come in the other day. A parent brought in an 8-year-old child, okay, and he was terribly, terribly knock-kneed. I just showed Dad how I took a little device off the shelf, put it in his shoes, and just showed Dad, not even realizing that it's going to be that dramatic when I changed his gait, but all of a sudden he wasn't knocking at his knees, he wasn't swinging one in front of the other, he was walking straight. The dad was amazed. I was almost amazed that, just seeing how rapidly putting something very minimally in his foot gear made all the difference to that young man. So I said to Dad, you got to get him back in. We've got to make him a custom orthotic. And we'll follow him as he grows till he's 18. Amazing what we could do for kids.
I think these are great stories. If these stories sound like maybe the life you've been living in regards to your feet, now's the time to get back and come back to Middletown Medical, where we have 3 great podiatrists. One of them who's been here for quite a time in the region, who does a great job and has a huge following, and that's Dr. Michael Wodka. If you need to call us, our phone number generally to schedule appointments is 845-342-4774. But Dr. Wodka works right over here at Maltese Drive, 35 Maltese Drive, and has regular hours every week. So please come in today and don't put off your procedures. Thank you.